Welcome to Pre-Surgery Services. Today's preoperative process includes financial counseling, preoperative assessment with virtual counseling, and biometry. These stations are interchangeable. To shorten waiting time in pre-surgery services, fasting guidelines for morning surgery, no food intake after 12 midnight. From 12 midnight to 6 a.m. in the morning, only plain water is allowed. No fluids after 6 a.m. in the morning. No other beverages are allowed. Blood pressure medication to be taken as per normal with sips of plain water, unless instructed otherwise by preoperative nurse. Do bring along your medications with labels on day of surgery. Oral diabetes medication to stop on the day of surgery, unless instructed otherwise by preoperative nurse. Insulin injection. Please follow the preoperative nurse's instructions to inject or omit your insulin dose before surgery. Fasting guidelines for afternoon surgery. 1 slice of plain bread or 2 pieces of plain crackers can be consumed. No food after 6 a.m. in the morning. From 12 midnight to 10 a.m. in the morning, only plain water is allowed. No fluids after 10 a.m. No other beverages are allowed. Blood pressure medication to be taken as per normal with sips of plain water, unless instructed otherwise by preoperative nurse. Do bring along your medications with labels on the day of surgery. Oral diabetes medication to stop on day of surgery unless instructed otherwise by preoperative nurse. Insulin injection. Please follow the preoperative nurse's instructions to inject or omit your insulin dose before surgery. On the day of the preoperation assessment, if your blood pressure is measured to be above 140/90 millimeters of mercury, or below 180/110 millimeters of mercury, you will receive a referral letter to your general practitioner or polyclinic. You will need to visit the clinic to control your blood pressure, and bring the reply letter with you on the day of surgery. A blood pressure diary will be given to patient to record their daily BP twice a day. If your blood sugar is below 4 millimoles per liter, or above 11 millimoles per liter, a referral letter to GP or polyclinic will be given. You will need to visit the clinic to control your blood sugar, and bring the reply letter with you on the day of surgery. Depending on your condition and surgery, we may do an ECG. A referral letter and heart appointment to heart specialist may be given if required. You will need to visit the heart specialist to check on your heart condition, and bring the reply letter with you on the day of surgery. You may be referred to anesthesia clinical evaluation to optimize your medical condition before surgery. You may be seen on the same day if you complete your preoperative assessment before 4 p.m. or have an appointment scheduled for the next few days. If you complete your preoperative assessment after 4 p.m., this is essential to ensure you can go through your eye surgery safely. On day of surgery, please shower before coming to ensure cleanliness. Do not apply hair oil or hairspray. Do not use hair accessories. Wear comfortable attire. Wear loose pants or skirt and a button front top, with short or loose sleeves. Avoid tight clothing as you may injure your eye when you change. Wear low-heeled, non-slip shoes. Do not wear contact lens and jewelry. Put on false eyelashes, makeup, or nail polish. Bring along your medications with labels and prescribed eye drops. Please do not bring excessive cash or jewelry. On day of surgery, kindly refrain from driving to SNEC for your surgery. It is compulsory to have one person accompany you home following the procedure. Otherwise, your surgery may be postponed. Post-surgery follow-up depends on your eye condition and surgery type. Return for doctor's consultation unless advised otherwise. First appointment will be 1 to 7 days after surgery, and second appointment 30 days after surgery. Do you require any of these documents? Discharge summary, doctor's memo, medical report, and completion of insurance form. Scan this QR code to find out how to apply. Unable to come for surgery due to feeling unwell or other personal reasons, scan this QR code to submit a request to amend your surgery date. We wish you all the best for your surgery. Thank you for choosing Singapore National Eye Center.